I'm Commissioner Ralph Spitaleri from Geauga County, and today present I've got Sheriff Hildebrand, our County Administrator Jerry Morgan, and from our Health Department Chris Wire. We are just here basically to just kind of give a public address to everybody. Our biggest focus today is to basically try to give an update, want to be 100% transparent and just give people a position of understanding and remain in a calm position so that there's a lot of rumors that are flying around out there. There's a lot of situations, and I just feel that we need to, basically give the message out to what it actually is of what's going on and what our situation is. And we brought some of the professionals here to just kind of reinforce what we're doing here on the county side of things. In addition to that, what we would like to, look forward to and different positions of what we are taking as far as a county to assure our residents are maintained safe, our employees are maintained safe, and that we're doing things according to the best interest of everybody involved. So I think what I'll first do is I'll bring up Jerry Morgan, who's our county administrator. Jerry, if you could go ahead and.
Thank you, Ralph. As Ralph said, my name is Jerry Morgan. I'm the county administrator. I work directly for the commissioners of Geauga County. I just want to state that the Geauga County commissioners are committed to the health and safety of the citizens of Geauga County as well as the employees. They've been monitoring the orders given by Governor DeWine and President Trump and are implementing new policies and guidelines to accommodate this unprecedented event. Commissioners are also in regular contact with the Geauga Public Health to ensure they have the most up-to-date local information. All county offices at this time remain in operational. However, offices and the courts have made adjustments to their operations, including controlling public access as a precautionary measures only. Anyone who needs to do business with the county should call ahead to verify how they may perform their needed actions. Commissioners wanted just to remind everybody also, if you have any questions, to go to the CDC website, the Ohio Department of Health website, or to use the Ohio Department of Health call center at 1-833-4-ASK-ODH.
All right,
Can you just, because I think that's a bite I want to use, can you just comment about what's going on, not just here, but all over the state and the country regarding the run on gun sales, that people are, the end of the world?
Well, the biggest thing would just be to keep calm. There's no need to run on anything at this time. Ohio right now, as of the last time I looked earlier today, has 119 cases. So remember, there's 11.7 million people in the state of Ohio. So it's a very, very small percentage that has this at this time. So, not only gun sales, but food and everything else. Get what you need, but don't go crazy about it.
Thank you. So the next I'm going to ask for Chris Wires to come up from our Department of Health.
Thanks. Hi, I'm Christine Wires. I'm the Director of Population Health. Our messaging stays the same. We currently have one confirmed case in the county. There is a number of testing being done out there. We know that. We know that those numbers will eventually change. But what we are asking people to do remains the same. We are asking people to social distance, stay that 6 feet away from each other in the event that you do have to go out to the grocery store, go to work, take care of your immediate needs with gas or banking or whatever. We ask that anybody that can stay home stays home with their children, and keep your family unit together versus neighborhood play dates or things of that nature. We're asking for people to wash their hands, and we're asking for those high-touch surfaces to be washed frequently with cleaning solution. So doorknobs, light switches, telephones, steering wheels, all those things. Other questions?
Also, Christine, if you just want to give somewhat of the best information that you have as far as a number count right now, still with Geauga County holding at, I believe, 1?
We're still holding at 1, yes.
1 case
yes.
at this time.
Mm-hmm. We are encouraged, we are at the health department following the same recommendations that are coming down from the Ohio Department of Health. So we're requiring all of our employees to check their temperatures before coming to work. Anybody who's showing signs and symptoms of being ill we need them to stay home, and this should be statewide. Anybody showing signs of a fever or signs of illness need to isolate or quarantine themselves at home and monitor their symptoms.
Okay,
Other questions?
thank you.
Sheriff, do you have anything you want to?
Well, I just want to say that, initially there was a run on toilet paper, and now there's a run on guns and ammo. I really think that if everybody takes care, we're going to be fine. We're going to get through this. They're taking all the precautions that need to be made. When you start asking people to stay home with their spouse and their families, and it's 24 hours a day, it might be a good time. Sometimes you got to take a break and take a walk, especially on a nice day like this. Get out of the house and take a walk, and then we don't have those problems. Our biggest concern is our employees because and the inmates that we house. The employees we need to keep healthy, and we are monitoring them every day when they come to work. We're working very closely with the fire departments and the health departments, and I just have to say that's one thing that is so great about this county is that we all work together very well. We've been having conference calls, we've been having personal meetings with the people, with the hospital. I really think that in Geauga County we are prepared, and anytime they want to get us all together, we're able to do that. And I feel very proud of the fact that that's the way we work in Geauga County every day, so it's not difficult to do it now.
I have two questions for you. One is, are you seeing an increase in domestic calls?
Well, not really at this point. It's typically in the wintertime we do, because of that fact that you're cooped up, and I suspect that we probably will. And that's why I mentioned that people need to take a break sometimes. And as you come through Chardon, you saw people walking the sidewalks like never before. I mean, number one, it's the first nice day in Chardon for a while. But number two, that's a good thing to do. Get some exercise. You know, you can't sit there and watch Netflix all day. So I think it's a good point.
How are you also handling the inmates? That's because you have a lot of people in there in close quarters.
We're monitoring them as well. New inmates that arrive, their temperature is taken because that is the first sign. Anything over 100.4 and then we're not accepting them, or they will go into isolation depending on the crime. But we are monitoring that daily. We have a doctor and 2 nurses there all the time, and are very cautious of that. That's one of the reasons we've shut down some of the programs, so that we don't bring that into the jail. And we don't want anybody coming and getting it from somebody in the jail. So some of our programs have been suspended, and hopefully it won't be that long, but I think it's going to work in the long run.
Beautiful. Thank you.
Yeah. And I guess in close, we appreciate the efforts that you guys have had also to just send a message out there to just restore a little bit of calmness, and at the end of the day, we're all working together, being briefed every day, and we're just blessed to have the people that we have in our county that work together so well. And we can't thank you enough also for taking time out of your day to come and get this message out there for us also. So thank you, and we appreciate your time.